Great. So, belated, good afternoon to everybody. Can spend just a couple of minutes. We'll have more time, I think, on Thursday to go through some more details around investment case in the area of mental health. But to give you a very quick overview and about where we got to. So, as a reminder, we started with the development of some methodological guidance back in 2019, 2020. It was eventually published in 2021. And this has helped to support or structure several investment case studies. So I've listed some of the country level studies that have been either finished or completed, others which are basically finalized but haven't yet been given the final clearance or haven't been published. And then we've got about two or three planned or ongoing new studies. And then in addition, and this was, at the suggestion of Nick and others, trying to sort of make some sense of where we got to and looking across the different investment cases. So we looked at 7 different mental health investment cases and have done a comparative analysis, which is also ready to go. But because we're waiting on the clearance from places like Bangladesh and Nepal and Uganda, we need to wait on that before we can really submit to the journal. So this is what the kind of output, if you like. And I think we all know about the methods. So it's the institutional context analysis, which has been led by UNDP team, and then the economic modelling of the costs and effects of different intervention and different intervention packages, and looking at both the health returns and then also the returns to mainly productivity. So final slide is just this one. So I think you were asking for sort of insights or lessons learned. So I think the main ones are as follows. These studies can certainly help to open new doors and maybe open a few minds as well to mental health. For example, the ICA and the interviews that go with that, I think definitely help to create new conversations that might not otherwise have occurred. So our second point is just that these investment cases can certainly help to inform system reforms, midterm plans, scaling up of services, preferably in the community. And to summarize, this is from the comparative paper looking across the studies to date. All of the studies have shown that the economic burden is very substantial, around 1% of GDP. So you could say that's not that much, but it is really when you think about it. And then whereas the investment costs are extremely modest, very low per capita costs of scale up, and the returns are very varied, really, I would say. But if we sort of extract and choose appropriate packages of the more cost-effective interventions, the returns are potentially very substantial. And then the lessons learned. Well, I think 3 I've listed there. One is about the window of opportunity. So as I repeatedly say, there is a risk that these studies are done just for the sake of it, because they're kind of offered, they're gleefully accepted, they're not too hard to do, but do they really make an impact? I think that depends on the availability of a window of opportunity, whether that's reviewing or planning, so that there is some cycle or planning mechanism for these studies to enter into to be most influential. Another one, we've had some of them have taken a long time, and particularly the last few kind of steps. As I mentioned, we've got a number which were finished really. Certainly, the economic analysis was finished at least last summer, and now we're hitting February and of 2023, and they're still not, finalised or approved or published, despite repeated follow up. So I don't know what that means. Whether it means enthusiasm is waning, or just too many competing priorities. And then a final reflection would be, and there's been a criticism of some of the studies, that there's too much of a bifurcation, a separation of the ICA versus the economic modelling part, so that they're essentially conducted by two different teams, and that sort of ends up being somewhat reflected in the reports, and that the conclusions and recommendations don't do a good enough job of kind of combining or integrating those two elements. So that was just a final reflection. And I'm sorry, I don't know if that was also mentioned with other areas, because I was unable to join. But back to you, and thanks for your attention.
Super, Dan, really good, thanks. The mental health cases, I think mental health and NCDs particularly were two that I was nervous about going into, because I just assumed that the returns on investment might not be up to the same levels as some of the other ones. But I've been really pleased to see that even with those, the case is really strong. And so the really good points, and I want to go over more of these tomorrow when we have more time, also on the way to make sure we're properly embedding the ICA findings into it, and how you can get the right process to do this.